Hi guys. How y'all doing today? I hope y'all having a wonderful and blessed day no matter where y'all are in the world. I'm just coming to just share some of my thoughts today on what's going on in the world. See the author? I even have her book Americana. Chimananda-ngozi-adachie. She accuses the Lagos hospital of negligence after her son's death. Lawyers for Adachie and her husband serve Uricare Hospital with legal notice after death of her 21-month-old son. Yeah, why is things happening like this now in 2026? You think if you bring your son to a hospital, yeah, you think it's a hospital like anywhere else in the world, that you wouldn't have a problem. But y'all, just because it looks good don't mean that it is good. There's a brain drain going on. Say 15 billion human capital loss annually. Brain drain routes Nigeria to UK, Canada, and US. I don't know what to say, guys. This has been a problem for some time. I was a registered nurse for, as they say, how long? Very long. Long enough to retire, y'all. And I'm telling you, I've traveled to Nigeria and lots of other places. I've stayed there for some months once upon a time so I could get some things done with my in laws, and heard the same kind of thing, y'all. One of my in laws' friend went in to have a baby, and she didn't come out alive, y'all. The doctor have nerve to explain to her family, I just nicked the uterine artery little. I don't know what happened. Like, what the heck? If the doctor don't know what happened, you know, what kind of a doctor is that? Some quackery? What the quackery, as they say, going on up in here? You know, the people just so religious that they can just get away with saying it's the will of the Lord, and they just take it. I was in the Gambia last year, and a farm manager's sister went in the hospital to have a baby, just a regular old vaginal delivery, y'all. And the young lady didn't make it either. From the symptoms her brother was talking about, she had what we would call here in America preeclampsia. That's where you have high blood pressure and all kind of other symptoms that could be life-threatening. But most times we give the patient a medication called magnesium sulfate, but it has to be monitored very well because it has side effects to giving that medication as well. Well, unfortunately, his sister didn't make it either. So let me just summarize what's going on here, and then discuss some of what's going behind the scenes with this brain drain thing. Let's talk about this recent tragedy just a little bit more in detail. Chimamanda-ngozi-adachie's son. In January 2026, acclaimed author Chimamanda-ngozi-adachie publicly accused Uterine Hospital in Lagos of gross medical negligence following the death of her 21-month-old son, Nkanu Namdi, on January the 6th. The incidents. Kanu was taken to the hospital for diagnostic tests, including an MRI, before a scheduled flight to the United States for specialized care for an infection. Allegations. Adachie alleges that an anesthesiologist administered a fatal overdose of propofol and failed to follow standard monitoring protocols. The family claims the child suffered seizures and cardiac arrest after being disconnected from a ventilator and carried improperly. It was said that the anesthesiologist walked down the hallway with the child over his shoulder and took him off the breathing machine, and that the baby wasn't monitored properly with what we call in America the O2 sat monitor that lets you know how much oxygen is in the blood, and heart monitors. And also said they didn't have the equipment to do advanced life support or CPR. Then, when I was talking about my in-laws, errors such as cutting a uterine artery during a C-section often stems from a lack of experience from a specialist and overworked, under-supervised staff. And sometimes they don't even have specialists, y'all. Just the doctor's just doing something that they not really equipped to do. Preeclampsia management. Preeclampsia and eclampsia are among the leading cause of maternal deaths in Nigeria, approximately 16%, and the Gambia. Ain't that something? 16% in both countries. Specialized monitoring and drugs like magnesium sulfate that are frequently unavailable. Can you hear me? Unavailable. When I was a labor and delivery nurse, I used to say, if I could carry one thing with me that was a medication to the motherland, I would bring magnesium sulfate so I could help save many, many mothers that end up having a need for it during or after childbirth. It's just sad, y'all. They say that it's just so frequently, you hear me, frequently unavailable or poorly administered due to personnel shortage. The role of the brain drain, 2026 crises. The brain drain is a primary driver of these failures, creating a medical tsunami that leaves local systems near collapse. Exodus of skills. As of early 2026, thousands of doctors and nurses have left Nigeria for the UK, US, and Canada. For example, by late 2025, over 16,000 Nigerian doctors had immigrated in the preceding 5 to 7 years. Dangerous ratios, y'all. Nigerian doctors to patient ratio has reached approximately 1 to 5,000. 1 to 5,000. Let that sink in. It's definitely awfully drastically far from what the World Health Organization recommends, which is 1 to 600. This is horrible, y'all. Consequences of the depletion: burnout and errors. Remaining staff are severely overworked, with up to 85% of health workers reporting burnout, which directly increases the risk of fatal medical errors. Loss of specialists. The fight of surgeons. Well, it's fight too, but the flight of surgeons and anesthesiologists, like the ones in Adachie's son case, means that high stake procedures are often handled by less experienced or unsupervised personnel. Resource vacuum. Brain drain often correlates with a lack of investment in basic infrastructure, leading to hospital lacking oxygen. Simple stuff like oxygen, y'all, or functional monitoring equipment. I know I used to laugh when I see these Nigerian movies, and whenever they be in the hospital and they quit breathing, the doctor would just take their stethoscope and put it on their chest and go, she's dead. Oh, he's dead. And that's it, y'all. They didn't do CPR. And I would be screaming at the screen, somebody do CPR. I even wanted to say, I know CPR. I can help. But y'all, sometimes art copies what's really happening in the world of the screenwriter. Y'all, I don't know what to say. All of this chronic underfunding, and they call it the Abuja failure. The most significant policy failure is a consistent refusal of governments to meet self imposed funding targets. The 15% pledge, as of early 2026, over 30 member states remain below 10% benchmark. Say the 15% pledge in 2001 Abuja Declaration, African Union countries pledged to allocate 15% of their national budget to health. And as I said a minute ago, as a reality, as of 2026, over 30 member states remain below 10% benchmark. Nigeria in recent years, only about 3.9% to 5% of the national budget has been allocated to healthcare. The Gambia, the government aims to increase its expenditures to just 7.5 by 2030, which is still only half of the 2001 target. So consequences, y'all, the underfunding leads to drug stockouts, the lack of basic monitoring equipment like ventilators or blood pressure monitors for preeclampsia, shifting the burden of families through out of pocket payments, which covers over 60% of health costs in Nigeria alone. The failure to retain staff. the Japa effect, as they say. The brain drain is not just an individual choice, it's a policy failure to provide living wages and safe working environments, massive exodus by early 2026, as I was saying about how many doctors they lost and how many nurses they lost. 16,000 doctors and 75,000 nurses to migration in the last decade. Economic loss. It's an estimate that sub-Saharan African countries lose approximately 15.86 billion annually due to the migration of physicians to high-income nations. Burnout induced error. Policies have failed to address the 1 to 5,000 doctor to patient ratio. Say again, WHO, the World Health Organization, recommends the 1 to 600. This creates a tsunami again. I'm just so sad about all this, y'all. As they say, weak regulatory oversight. The death of Chimananda-ngozi-adachie's son and my family friend and our land manager's sister. It's just highlights of failure in clinical governance and enforcement of medical standards. They call it the 3 delay model. Policy failures often focus on the third delay, receiving adequate care after reaching a facility, lack of enforcement. While Nigeria induces a free emergency C-section policy in late 2024 to reduce maternal mortality, the lack of oversight means high-risk surgeries are still performed by unsupervised or undertrained staff. Regulatory gaps. In cases of gross medical negligence, such as those alleged against Uterine Hospital in 2026, the legal and regulatory systems often move slowly, failing to provide the swift accountability needed to deter further negligence. Giving you the keys to statistics. I gave y'all that, but I'm going to tell you one more time. Maternity mortality. Nigeria still accounts for 14 to 34%. In fact, this is something new. I'm just not learning. Nigeria accounts for 14 to 34% of all global maternal deaths. Let that sink in. 14 to 34% of all maternal deaths, despite having only 2.6 of the world's population. Workforce gap. Sub-Saharan Africa is projected to face shortage of 5.3 million to 6.1 million health workers by 2030. The human cost of negligence. It's just horrible. It's just horrible. I don't know what else to say, y'all. I don't. What is going to be the answer to this? I want y'all that's out there who's nurses and doctors abroad to think deeply. If you've been abroad for a good while and you have some savings and you're in organizations that can do fundraising, if y'all would just consider going back home for at least 4 years to give back, to properly train the medical staff that's there and the medical students, nursing students that's in training right now or will be in training in the near future. Some of them don't even have proper equipment in the classroom so they can learn, and they don't have access to learning what they're supposed to learn in the hospital while they're students. They don't have enough teachers to train them properly. Why brag on what somebody can do abroad? Because I got an email from my ex one time, a WhatsApp, and it was bragging about some doctor that he knew that had done some kind of a fancy surgery in utero, inside of the mother, here in America. And I'm thinking, for all he did, they have so many doctors here that could have done the same thing. That if he could have used those same specialized skills in Nigeria, it would have meant the world. And if he could have just teach those skills, even if it's just 4 years, it will make a big difference in the survival rate of the mothers and the babies. We got to have somebody to care, y'all. Can y'all just pass these concerns to other people that you know that's involved in healthcare? Because I'm telling y'all, every time I see the party, spree, or whatever, I be saying, I'd be happy if I could just see y'all go back home and help the people. And then I'll be right there with y'all partying. Because y'all done help the people that need the help. The people that see y'all as superheroes for saving their lives. It shouldn't be a case where every time somebody goes into the hospital, it's like winning the lottery. It just shouldn't be that way. To walk out alive. That ain't good, y'all. You should be able to feel safe going into a hospital. That you can't even be comforted thinking that I got money, I'm going to a good hospital, and then find out that it's all a sham because they don't really have real doctors, or the doctors that they have overworked and undertrained, and they can't help you all. That you might have to be praying to the Most High for a miracle for you to make it out of there in one piece. But y'all, let me know what y'all think. If you have not subscribed, please do. Comment, like, and share. I want to hear from you. Let me know if you've been thinking about going back to really make a difference, to really be the change that we're looking for, that you looking for. And not just say, when I go home to visit, like one of my in-laws that's a cardiac doctor, a heart surgeon, and he'll go back to visit, but can't convince him to train. Many people suffered for folks to go abroad to medical school and nursing school, pharmacy school, and then they just forget about them after they have the soft life. I'm just asking for 4 years. That's it. Because who knows, after 4 years, you might want to help even more. It's not good enough just to go back when it's time to retire, y'all. It's just not. It's just not. I know it's easy for me to say now that I'm old and retired, but y'all, my dream was to be a midwife and go back with my husband that at the time was a pharmacist and he was supposed to be a PharmD. But y'all, it just did not work out. It just wasn't meant to be. And time just passes you by. But I'm talking to y'all young doctors and nurses out there who got some time left before retirement age to go back and make a difference, y'all. Help your people. Help our people. We're all dependent on you. I don't want to think that I need to have surgery in the U.S. before I go back to the Gambia or before I visit Nigeria or anywhere else on the continent. You know? Why should I be afraid to get ill while I'm away? Because I don't know if the doctors even know what they're doing, you know? It's sad. When the doctors come from, they are very, very competent. I have an appointment with a doctor next week that her name sure sounds Nigerian. And her face looked Nigerian, and I picked her because she had lots of experience in her resume, you know. So I'm like, yeah, let her check my cataract. And if I need the surgery, do my surgery. And if I can wait till next year, hopefully she's still there so she can do my surgery. But y'all, imagine if the excellent doctors went back and trained others that you can just reach down, even if it's just for a moment, and pull up the next generation. So when you go back home, or the people that you left behind need medical care, they can have safe and adequate medical care. I want that for everybody's family. I'm so sad for the author, and she got apologies and she got condolences from lots and lots of people, including the president. But y'all, it's sad when anybody passes in a hospital. I'm sad for everyone that has gone when it could have been avoided just due to negligence and a failing system. Anyway, y'all, just having my say. Please, please, comment down below. Like, share this video. Maybe it'll put somebody's heart who can gather a team, a medical team together so they can do some fundraising and go back to the motherland, whichever country they want to go back to. So they can train people, not just for a summer spree of doing surgeries or whatever for a week or 2 or 3 months or whatever, but for some substantive years so it can make a real difference of building that infrastructure. The government is not going to do it no time soon that I could see. The people at the top are taking flights to go abroad to get taken care of. The everyday people can't do that. And unfortunately, even the people that's not everyday, the people with money, couldn't get back in time to save their child. So sad. Condolences to everybody who's lost family members in the motherland due to a lack of competent medical care. Until next time, I love you all. Peace, peace, power to the people. As my mama would say, we can do it. I know we can do it.